Welcome to this comprehensive class member transition program policy training provided by the UIC College of Nursing. This training will address post-transition processes in the comprehensive program. This training will enable comprehensive program staff to understand the processes that take place after class members have moved into the community. It will help them understand what incidents need to be reported to the comprehensive program and also complete comprehensive program documents correctly. The information provided in this training module is outlined in policies P5.02, reportable incidents, P5.01, documenting post-transition engagement and status changes, P5.09, transitions to non-permanent supportive housing settings, P5.6, post-transition closure to services, and P5.7, temporary out-of-home stays. Please note that this training module presents an overview of the information provided in more detail in these policies. CCMTP program staff should read and understand each policy in detail. Documenting post-transition engagement and status changes. Policy P5.01. The comprehensive program requires prime agencies to document post-transition care management visits, as well as nursing visits, using the web app data management system. This is in addition to any internal documentation system that the prime agency may use. The minimum in-person care management monitoring schedule is as follows, although more frequent visits may be required based on class member needs. At least monthly for 18 months post-transition. Prime agency registered nurses, RNs, are required to meet in person with class members within 7 calendar days of being notified of an unplanned hospitalization or emergency department visit. Notes should include the following elements at minimum: the purpose of the visit and the role of the staff visiting, a description of the class member's status, including any changes since the last encounter, where the visit took place, who was present during the visit, assessment of current functioning, interventions provided, any interdisciplinary discussion or consultation that occurred, progress towards comprehensive service plan goals, a plan for future service plan implementation, and a summary of any outstanding care needs or items for follow-up. All documentation should be entered into the web app within 5 business days of the visit taking place, and all required engagement by care management staff or nursing staff must be documented and may be reviewed to ensure compliance with contractual obligations. Per policy P0.08, care management, prime agencies may request approval to conduct and document virtual care management visits under certain circumstances. The class member must be stable in the community, and there must be documented ongoing collaboration with in-person providers, such as ACT, CST teams, the MCO care coordinator, or residential staff. Class members may also request virtual care management visits as a preference. If requesting virtual visits for class members as preference, the prime agency should secure signed documentation from the class member indicating their request. Prime agencies may initiate the approval process by completing Form 5.8, Virtual Visit Request Checklist and Quality Review, and submitting and requesting a case consultation in the web app. UIC Con and IDHS must approve all virtual care management exceptions. Care management and RN visits must always be in person following reportable incidents. In-person care management visits are expected until approval is received. Prime agencies may conduct virtual care management visits temporarily without IDHS approval for other circumstances, including when the class member has an actively contagious illness, the class member self-discharges and changes their location frequently, the class member is unavailable due to work or school schedule, or the class member is currently incarcerated, hospitalized, or in a place or situation deemed unsafe for prime agency staff. If the barrier to in-person care management visits continues beyond 30 days, a case consultation must be requested via the web app. Comprehensive program staff and UIC-CON must be kept up to date on significant changes in class member status after they move to the community. This includes changes in address and phone number, guardianship status, eligibility for the program, disengaging from the program, or the class member's death. If a class member has a change in address or phone number but is remaining in the CCMTP, update this contact information in the web app. Updated contact information should be entered into the web app within 5 business days of the prime agency becoming aware of the change. Post-transition closure to services, Policy P5.06. A class member may be closed to care management services if, after transition, they return to a long-term care setting and are unable to transition back to the community within 90 days, are incarcerated for more than 90 days, or move outside of the state of Illinois. A class member may also be closed if they no longer desire to continue services. Closing a class member during the 18-month post-transition period requires approval from IDHS. Closure requests due to safety concerns require a case consultation, while other types of closures may be completed through a desk review process. The prime agency will initiate a request for closure by uploading the 5.7 post-transition closure checklist and requesting a case consultation in the web app. Temporary out-of-home stays, Policy P5.07. When a class member is admitted to a skilled nursing facility or SMRF, the prime agency is responsible for managing housing retention, submitting the reportable incident, and providing care management services for 60 to 90 days, depending on the class member's preference related to returning to the community. Prime agencies should update the class member service plan to reflect the readmission and, if applicable, goals they need to work on in order to return to the community. Transitions to non-permanent supportive housing settings, Policy P5.09. The Colbert-Williams consent decrees and the Comprehensive Class Member Transition Program identify permanent supportive housing, PSH, as the most integrated setting for class members who transition out of institutional settings. However, not all class members wish to move to PSH, and some may have clinical needs that can only be met in a non-PSH setting. PSH refers to integrated permanent housing with tenancy rights, linked with flexible community-based services that are available to consumers when they need them, but are not mandated as a condition of tenancy. Non-PSH settings include, but are not limited to, supervised residential programs, supported residential programs, community integrated living arrangements, supportive living programs, and other residential treatment settings. Both the prime agency and the CCMTP Quality Monitoring Unit will evaluate class members who move to non-PSH settings for their desire and appropriateness to move to PSH. The prime agency should evaluate at the time of the 180-day post-transition service plan update. This evaluation and its outcome must be documented in the service plan update. If the class member wants to move to PSH and is clinically appropriate for such a move, the prime agency must make an offer for a secondary transition to PSH within 60 days. If it is the class member's desire to remain in a supported environment, that should be documented in the service plan update. The IDHS QMU will facilitate a collaborative review with the prime agency to discuss all class members due for their 6, 12, or 18-month secondary transition review on a monthly basis. The prime agency should follow protocol for reporting non-PSH moves in the web app and completing required follow-up procedures outlined in policy P5.09, Transitions to Non-Permanent Supportive Housing Settings. Post-transition case reviews and case consultations are described in policy P3.04, Case Reviews. Case consultation calls are held both pre- and post-transition at the prime agency's request. The process for requesting a case consultation is described in detail in Orientation Module T3.2 and in Policy P3.04, Case Reviews. Post-transition calls are scheduled 60 days after notification of the class member's move. Post-transition call attendees will include, at minimum, UIC-CON, the class member's assigned IDHS quality monitor, and the class member's assigned prime care manager. Prime agencies are responsible for ensuring any other necessary staff attend the call. This may include, but is not limited to, subcontractor staff, the transition coordinator, housing locator, CST, ACT staff, the registered nurse, and occupational therapist. Other individuals may be invited as needed, for example, managed care organization staff or UIC assistive technology unit staff. During post-transition calls, UIC-CON will review the status of the clinical recommendations that were previously provided in the web app. Prime agencies should be prepared to discuss the implementation of each recommendation that was made. Post-transition call notes, including documentation of the status of each clinical recommendation, will be published in the web app within 5 business days of the call. UIC-CON may request a IDHS quality monitoring review if there are clinical concerns regarding the class member status that are discussed during the post-transition call. Reportable incidents, policy P5.02. Reportable incidents are significant events that have the potential to negatively impact a class member's stability in the community. The comprehensive program requires that these incidents are documented and formally reviewed when they take place within the first 18 months of transition into the community. Prime agencies are responsible for documenting all elements of the incident using the reportable incident feature in the web app. The form requires information on when the incident took place, when the prime agency learned of the incident, and who was involved. There is also a space for the prime agency's narrative of the incident and a description of the prime agency's response. The prime agency must submit all reportable incidents in the web app within 24 hours of learning of the incident. Incidents that prime agencies are required to report include death, hospitalization or ER visit, SMRF or skilled nursing facility admission, notice of eviction, other serious incidents impacting class member housing retention or community placement, such as safety concerns for the provider, a suicide attempt, incarceration, or missing persons. Per comprehensive program policy, all skilled nursing facility and SMRF readmissions and any other serious incident impacting class member housing retention or community placement will be scheduled for a formal review call with UIC-CON. Current versions of all comprehensive program policies and forms can be found in the web app library, and educational resources can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk, linked at the bottom of every page of the Colbert-Williams training website. Thank you for your attention and efforts to ensure safe and successful class member transitions.